reporters via a video link. And we are expected to be updated on the situation of the ongoing coronavirus pandemic. Doctors there will be updating us on the latest developments in medical treatment and scientific development to finding a cure for the COVID-19 outbreak. All questions and answers will be in English today, and reporters will be raising questions via a video link. Now we're looking at the doctors walking into the press conference room in Wuhan and sitting down ready to kickstart.
Ladies and gentlemen, friends from the media, good afternoon. Welcome to today's briefing. Now the COVID-19 epidemic has become a common challenge facing the whole world. In order to save people's lives, the Chinese government has acted decisively and launched a large-scale rescue mission. In a very short time, China had dispatched over 330 medical teams and sent more than 40,000 medics to the virus-hit Hubei province. Today is a great honor for us to invite 4 experts among those 40,000 medics. All of them are from Peking Union Medical College Special Aid Medical Team, and they will share their experiences in the treatment of COVID-19, especially in severe cases in Wuhan. Before I introduce the distinguished experts, let's watch a short video about them.
救死扶伤，扶持艰辛。
选择了这个职业，真的就是你的职责所在。
我们的病人非常危重，我们也做了很多的努力。
要求我自己在里面多待一些时候，来告诉他们说，别着急，你要做什么，或者我来一块儿帮着你一块儿做什么，尤其是越有风险的时候。
这个病人情况的好转呢，对我们来说意义是最大的。
好了，真正的是对你们爱的。
我们总是要坚持到最后，等到这些病人的情况能够真正得到稳定，我们才真的会离开武汉，离开湖北。所以只有在大家都好了的时候，我们才真的会最后才会安下来。
Welcome back. Please allow me to introduce you the 4 experts from Peking Union Medical College Hospital. Professor and Dr. Du Bin, Director of Medical ICU. He is also the chairman of the Intensive Care Medicine Branch, Chinese Medical Doctors Association. Professor and Dr. Xiaowei, Professor of Cardiology, Deputy Head of Department of Internal Medicine. Dr. Cao Wei, Associate Chief Physician and Deputy Head of the Department of Infectious Diseases. Dr. Wu Dong, Associate Chief Physician at the Department of Digestive Disease. Now, let them say a few words about their team and also about they themselves. Dr. Du, please.
Good afternoon, ladies and gentlemen. This is Dr. Du Bin again. And I'm one member of the national expert team, as well as a member of our team. And I spent the last 2.5 days to go to 5 different hospitals in 5 cities to visit review the most critically ill patients with COVID-19 there, and just rushed back to Wuhan a few hours ago. And I would like to say a few more words about our team. As you may know, the Peking Uni Medical College Hospital is the #1 hospital according to the what we call the National Best Hospital Ranking for about 10 years. And it is the responsibility of my colleagues and I to participate the medical rescue team whenever the local health care resources has been overwhelmed by the COVID-19 outbreak. And we have spent the first initial couple of days to remodel one of the general wards into the intensive care unit and started to admit the most critically ill patients with COVID-19 since February the 4th. And it is not ourselves fighting against the COVID-19 alone. We have strong reports. We have strong supports from the teams of the Tongji Hospital as well as the other, medical rescue teams. And in addition, we also have very strong support from our colleagues in our hospital back in Beijing, because we have weekly teleconference to communicate with them about the most difficult cases, which can maximize our efforts in order to rescue the patient lives. Thank you.
Thank you very much, Dr. Du. And Professor Yan, please go ahead.
Hi, good afternoon, ladies and gentlemen. I'm Dr. Yan from the Internal Medicine of PUMC Hospital. My duty in Wuhan is to coordinate the different departments of internal medicine for successful performance. I also propose and organize the MDT with PUMC Hospital. As a cardiologist, I'm also responsible for the management of COVID-19 patients complicated by cardiac events and those with previously established cardiovascular diseases. Thank you.
Thank you very much, Dr. Yan. And then Dr. Cao, please.
Good afternoon, ladies and gentlemen. I'm Dr. Cao Wei from the same hospital, PUMC Hospital. I'm a physician of infectious diseases, and I work to treat patients of different infections. I arrived in Wuhan on February the 7th and have been here ever since then as a member of the national medical team of PUMC Hospital. As a team, we work together, as Dr. Du said, to emergently set up an intensive care unit, and have been taking care of the critically ill patients of COVID-19 in Wuhan. Personally, I participated in the clinical care of these patients, and I'm also involved in the coordination of the clinical collaboration with local hospitals here in Wuhan. Thank you.
Thank you very much, Dr. Cao. And last, Dr. Wu, please.
Thank you. Good afternoon. I'm Dr. Wu Dong, an associate professor in gastroenterology in PUMC Hospital. I've been working there ever since 2003, exactly when the SARS epidemic took place. So I came to Wuhan about 5 weeks ago, and I took the service here as a calling to myself, because last time I wasn't offered the opportunity to fight coronavirus, and I don't want to miss it this time. So currently, I'm an attending physician working in the ICU, taking care of patients who are very, very sick. So I'm very glad to share my experience with you. Thank you.
Thank you very much to all the experts. You are doing a great job because you are saving people's life, competing with the death. And then the floor is open for questions. Please indicate your institution before asking the question. please raise your hands. Okay, on the left area, the first line, the gentleman in blue shirt, please.
Hi, I'm from Reuters. I have 3 questions. First, what is the current risk of reinfection amongst recovered patients in China? Second, how does the weather affect infection rates, and should we expect higher or lower rates of infection as it gets warmer? And last, when can we expect to find patient 0 in China, and what clues do you have so far? Thank you.
Dr. Yang, would you please answer the first question, and Dr. Cao about the second? Thanks.
The first question is about reinfection. Actually, the reinfection is a problem after patient discharge from the hospital. In China, a patient discharged from the hospital and recovery from COVID-19 will be followed regularly at 2 weeks and 4 weeks after the discharge. This patient will also be monitored by local inspectors. They will be asked to isolate themselves at home at least 2 weeks. Also, they will be asked to take their temperature twice daily. If the temperature relapses, the patient will be sent to hospital for chest CT scan and nucleic acid detection. One point I would like to address is that nucleic acid positive alone doesn't mean that the patient has the intact virus particle in his body. Also, it doesn't mean the patient is infectious. So the nucleic acid positive alone that can be seen after virus infection is not a signal of reinfection. So if we think the patient is reinfection, we should have the fever, should have the progression of chest X-ray. Thank you for the question.
And Dr. Cao, please.
I'll take the second question, and I bet that's a question most people are interested in. Currently, there have been no data regarding COVID-19 as its relation with the weather issue. But if we take a look from the past experience of SARS, which was another coronavirus, we will be able to see that the factors that influence the rates of infection actually are multiple factors. For example, including the gradual loss of virulence with the time progression or regain of virulence because of mutation, and other joint measures of prevention and control, etc. Among them, unfortunately, the impact of weather hasn't been confirmed yet. Thank you.
Okay, next question, please. Okay, the middle area, first line, the gentleman in black suit, please.
Thank you very much. I'm from China Global Television Network. My question is, could you please introduce the latest situation of the combined method of treating the COVID-19 patients with the TCM, the traditional Chinese medicine, and the modern medicine? And also, what kind of patients are more frequently be treated with the method of TCM, and how are the effects? Thank you.
I'll take the question, and I think some of my colleagues might add some comments after my words. And it's my belief that this is traditional Chinese medicine is both familiar and unfamiliar with our practitioners of Western medicine, because we are, at least in Wuhan, every day we're working together with my colleagues from the traditional Chinese medicine. And it seems to me, at least in my mind, that traditional Chinese medicine works quite well in patients with mild diseases and in those who recovered from their critical illness. And however, I do notice that there are a lot of suspects about the efficacy of traditional Chinese medicine. I would say that TCM and Western medicine did not share the same philosophy. They have quite different philosophies. And they have quite different evaluation system for efficacy. For example, whenever in Western medicine, whenever we have the chance to test the efficacy of a specific medication in Western medicine, we will try to separate patients in different groups and give the patients who are assigned randomly into the experimental group or the study group a specific drug at fixed dose and fixed duration. And then we try to interpret any difference between the two groups with regards to clinical outcome as a manifestation or as an evidence of the efficacy or safety of the specific drugs. But however, this is not the case for traditional Chinese medicine. From my own observation, when working with the TCM practitioners, I noticed that even for patients with quite similar appearance from my personal point of view, they will prescribe quite different medications and with different doses every day. So which will make the evaluation system futile or invalid. So it's very hard for us to assess the efficacy and the safety of the TCM from our, the Western medicine point of view. But my belief is that we should respect each other. We should know that the Western medicine and traditional Chinese medicine has their own strengths and weakness. And we should learn from them. And also, we encourage our colleagues in the TCM sector. They will know what we are doing, and they will adopt our system of evaluation or assessment in order to let not only us, but also the international community to understand what they are what they are doing. Thanks.
Anyone want to add some words? Yes, please.
Yeah, I do have some comments. First of all, I agree with Professor Du in that we don't have panacea here. We don't have any specific antivirus drugs or medication that has been proved effective. But from a perspective from gastroenterology, which is my specialty, I would comment that at least for some cases, traditional Chinese medicine seems work well, because we know that some patients in the ICU, their bowel movement just stops and their abdomen is quite distended. In several cases, this is severe enough to force us to stop the enteral nutrition, which we all know that is essential for the patient to recover. So we use TCM to treat this type of patients, and I would say that they have very good laxative effect, which enable us to continue to feed them. Thank you.
Okay, next question, please. Okay, the gentleman in the first line, mid area, I guess is from India.
Thank you. First of all, let me compliment the doctors, not simply who are here, but hundreds of their colleagues who went to this epicenter and tried to confront this virus or the vicious virus head on. Definitely the questions today as the virus winds down, as per the figures in Wuhan and probably in Hubei and rest of China. The questions are being asked is, will there be a relapse? Will there be a second wave that can come up at a later stage or anytime soon here? Because it's happening all over the world now. And secondly, there is not much data that has come out about the virus impact on children. Now that there is this debate about when the schools to be reopened, not simply here, but elsewhere where this virus is propping up, perhaps what exactly, or is your rather reading of this virus impact on children of different ages? Thank you.
Okay, I'll ask my colleague, Dr. Cao Wei, to answer the question about the relapse, and I'll take the question about the children.
Thank you. I will take the first question. We all know that the status of pandemic has been declared by the WHO a few days ago, which means that the situation of the epidemic globally will not be solely dependent on the situations in China or any other single area or countries in the world. Currently, after 3 months fights, the outbreak in China, which started from last year's December, has almost seen its end. And I think we will still wait for another month to see and make the final judgment. But for me, a second outbreak, domestic outbreak, in China wouldn't be a great concern, as under such measures of prevention and control. But we all know that another important source of newly onset cases now come from the imported ones, the imported patients from outside China. So it is most probable that the newly reported cases, including the imported ones, may be kept at a relatively low level, but may last for a certain period of time. Thank you.
Okay, the second question concerned about the COVID-19 in children. Actually, from my own observation and discussion with the pediatricians, we know that there are some children that got infected with COVID-19, but however, majority of them are doing quite well. And there are actually 3 recent publications, one in JAMA, describing 9 infants, all under the age of 1 year. And the other is about 6 children with age from 2 to 7 years old. And among all these 15 children, that only one was admitted to the intensive care unit, requiring some sort of supportive therapy, including oxygen therapy. However, all survived. All children survived. And another recent paper just published earlier today, in Nature Medicine, described that among all the close contacts, the adults have a higher likelihood, about 2.7 times likelihood of getting the disease of COVID-19 than children. We currently don't know what is the rationale behind this phenomenon, but we do understand that children, despite the fact they got infected, but majority of them exhibited mild disease course and all of them recovered. According to my understanding, what has happened in Wuhan, in Hubei, and in other provinces. Thank you.
Okay, next question, please. Okay, the gentleman in the red area, third line, in the suit. Right area, third line, in the suit. Yes.
Thank you very much. Sjoerd den Daas with NOS, the Dutch public broadcaster. Doctors, could you give us a bit of an insight in how the situation is now in the hospitals in Wuhan? We've seen that several temporary hospitals have been closed down. Also, what I would like to know, ever since we're talking now to the best doctors of this country, what advice or what lessons would you like to share with people in the front line in other countries that are facing the start now of the epidemic, like for instance in the Netherlands? Thank you very much.
Anyone who wants to answer the question? I'll answer first. Yes, you are right that it's my belief that all the what we call mobile cabinet hospitals has been closed. And some of the designated hospitals for COVID-19 has also been closed either discharge their patients or transferring their patients to other designated hospitals. And it seems to us that like Dr. Cao just said a minute before, that the outbreak of COVID-19 in Wuhan and in Hubei came to an end, it seems to me, although we should be alert to any abnormal signals or sporadic cases that are arising from communities, what has been happened during these days, and also as well as the imported cases from other countries and anywhere else. And for your second question, what kind of lessons or what kind of experience we can share, that there are so many things. But however, I should say that the most important thing, when we are talking about, when we are combating the infectious diseases such as the COVID-19, is to prevent and to control the disease rather than treatment. So treatment is only secondary. Prevention and control is primary effects that you can take and you can learn from what we said. Last time I remember that talking about plan, you must have plan. And actually, failure to prepare is preparedness for failure. So even now in Wuhan, in Hubei, we have fewer and fewer newly diagnosed cases. And we should remain alert. And we should prepare for the future sporadic cases and the future imported cases, and to learn from our own experiences, from our own success and failures. Thanks.
Yes, Dr. Yan, please.
To my overseas colleagues, I want to address 2 points. The first is the doctors, you should take good care of yourself from the coronavirus infection, because this is the precondition for you to take care of patients. Also, it's a precondition to protect your colleagues and your family. My second point is the public should be educated widespreadly to protect themselves. The measure is not so complicated. Just wash hand, wear mask, and avoid gathering, etc. Otherwise, the healthcare facilities and systems will be overwhelmed because of the outbreak of COVID-19. Thank you.
Okay, Dr. Wu, please.
I want to share a few words. For the general public of other countries, I want to say that we totally respect that every nation, every people, you have your own condition that could be very different from others. We are not saying that, well, this is Chinese example and you should follow. We're not saying this. We totally respect that. You should take your own actions. But every one of us should take this very seriously. Take necessary actions, change your behavior, and be responsible. For the medical community, I would like to say that we have to protect them, because in the last few days, we know that our European colleagues are also contracting the disease during their daily practice. And the proportion is quite similar to the early time in Wuhan. So we need to protect our medical staff. Also, working in the ICU, the environment is quite stressful, and the mortality is relatively high. As a physician, you know, from time to time, you will lose some of your patients, no matter how hard you have been trying to save their lives. Though this could easily damage the morale of the ICU staff. So my suggestion is that rest and relax is very important. You need to take very good care of yourselves. Thank you.
Okay, next question, please. Okay, the gentleman in the right area, second line, please.
Thank you very much. I'm from the People's Daily English Language app, and my question is, as we all know that some countries are short of medical resources, so the majority of patients with mild symptoms have to stay at home in isolation. Which alarming signals they should heed to prevent dangerous escalation? Thank you.
Okay, Dr. Cao, please. I will take this question. Thank you. First, if you have to do home isolation because of other reasons, then the first important thing is to identify or make sure that you are the right person that can do home isolation, which means that to make sure that you are not associated with currently already identified risk factors of deterioration, such as including the elderly people, people with comorbidities or multiple comorbidities, including hypertension, diabetes, chronic lung diseases, or other chronic diseases. And secondly, if you are young and you are generally healthy and you have decided to do home isolation by yourself, then it is very important for you or one of your family members to keep a close eye on your symptoms or feelings. Once you begin to have persistent high fever, or when you begin to feel short of breath, or maybe you have felt altered mental status, it is a time for you to go to the doctor and seek help. And the last and most important, during the time of home isolation, just make sure to not let your family members get the virus from you. There are multiple measures of prevention and protection for the family members, and you can get a full version of it from the WHO website, I'm sure. Thank you.
Okay, next question. Okay, the lady in the middle area, third line, from South Korea.
Thank you. I'm a journalist for South Korean newspaper, Gyeongyang Sinmun. The problem of COVID-19 infection by medical staff in Wuhan is a little bit serious. What protective measures are the medical staff taking? Please explain the local situation as a medical team. Thank you.
Can you repeat your question, please, and speak slowly?
The problem of COVID-19 infection by medical staff in Wuhan is a little bit serious. What protective measures are the medical staff taking? Please explain the local situation as a medical team. Thank you.
I do believe, thanks for your question. I do believe that my colleague, Dr. Yan, has already answered the question. But anyway, I may add a few words. That, as Dr. Yan said, that there are multiple reasons, multiple factors contributing to the infection of COVID-19 infection in the healthcare workers, especially during the initial stage. One is the lack of knowledge. Lack of knowledge that this is a human-to-human transmission disease. So you can see, you may know that a lot of healthcare workers have been infected in a couple of local hospitals in Wuhan, such as the Wuhan Central Hospitals. And this is a hospital that located very close to the Huanan seafood market. That at the initial phase, that many patients went there to see doctors, and the doctors don't know. They didn't know this is a human-to-human transmission disease. And the second important factor is the lack of personal protection equipment, PPEs, especially during the initial phase. And you can see that as many external assistants came to Wuhan, as the supply of the PPEs became adequate, that as just mentioned by Dr. Yan, by my colleague Dr. Yan, that no healthcare workers has got infected anymore. I mean, during the second phase, if we can call it. And another important lesson we learned is that even within the same hospitals, that some of the specialists, let's say ENT doctors, the eye doctors, became easily infected. Then their pulmonary, colleagues, then their emergency colleagues, or the ICU colleagues. And my personal interpretation is that whenever you see the eye doctor or ENT doctor, that he or she will have a very close contact with their patients, right? So that's the major reason for the phenomenon that they got easily infected, in addition to the lack of knowledge of infectious diseases among these specialties. So my belief is that it is important to let you colleagues, no matter what specialty they are, that they got educated, they got trained about these infectious diseases in order to prevent the nosocomial transmission of COVID-19. Thanks.
Okay, next question, please. Middle area, second line, the gentleman.
I'm from Bloomberg News. Thank you for taking your time to speak to us today. I'm sure you're all very busy. I have 3 questions. My first question is, what are the underlying conditions that really influence whether a patient survives or doesn't survive from this disease? Dr. Cao mentioned various comorbidities, but what are these the main factors you look for when you look at say patients who do and don't survive? My second question is, now that you're saying that the outbreak in Wuhan and Hubei more generally is sort of petering out towards an end, what do you expect the case fatality rate to be across the whole province? I think in Wuhan initially it was about 4. It was much higher than in the rest of China. Do you expect the case fatality rate in Hubei to come down towards the rate in the rest of China? And my third question, and goes back to the first question from Reuters, do you expect to be able to trace the patient zero where this disease crossed from animals into humans? And is your expectation that will be linked to the seafood market that Dr. Du just mentioned? Thank you.
I will take the first question. As I just mentioned, there are some risk factors already identified for COVID-19 patients, including the elderly people, comorbidities, etc. And these are the risk factors you could identify before you go to the hospital once you have been diagnosed. And there are also very important signals showing that you are transferring or you are processing from a mild type of case or common type of case to the severely or critically ill patients, which includes the change or continuous decreasing of lymphocytes, which is the indication that your immune system is gradually being broken down, and also the elevation or robust elevation of inflammatory markers, which is also another sign that the immune systems are activating. And also, if there is progressing changes of the lung radiology changes, including the infiltrations of bilateral lungs, this is another important sign you should pay attention to, which indicate you might be going to the critically ill patients. Maybe Dr. Du have.
Well, for the risk factors for mortality in patients with COVID-19, I do believe we are still waiting for more evidence coming from clinical investigations, because we previously, during discussion with my colleagues, all of us believe that the hypertension is a risk factor. for either the severe cases or the mortality rates. However, we also know that hypertension is associated with age, with older age. So currently, we have no idea that which is a confundus, which is the confounding factors, because these two, risk factors, older age and the hypertension, diabetes as well, are closely correlated with each other. So we're still waiting for more evidence. But however, according to current data, I agree with Dr. Cao, is that the lymphocytopenia is one of the signal. And probably the cardiac injury biomarkers is another signal for mortality. And the second question concerned with the case mortality rates. I am sorry that I don't think this is the right time to calculate or estimate the case mortality rates, even though right now majority of the patients are discharged back home. But we are still having more than 3,000 or 4,000 patients in the hospital. We still have no idea how many of them will survive, how many of them will die. There are a certain number of them will die, absolutely. So it's not the right time to estimate the case mortality rate at present. In my mind, that case mortality rate is a retrospective term rather than the terminology we can discussing right now. And we also know that the supportive, life-sustaining treatment that employed in the intensive care unit might prolong the patient life. So which will make some early deaths into a late death. That's one of the reasons for the later increase in the case mortality rates you can see. And the reason for a high case mortality rate in Wuhan than in other provinces, that I just can't remember if I have already answered the same question in the last press conference or not. But anyway, in my mind, that the reason number one is that there is always a learning curve. That our colleagues, healthcare workers in other provinces, they learn from our experience, and they learn from our failures, so they can treat their patient better than us. And the second, they have much fewer cases than what we have here in Wuhan and in Hubei, which means that patient there had a better chance for better medical care. They have enough resources, they have enough human beings, they have enough healthcare workers around them, they have enough ventilators, monitors, and all the other devices. I don't think the difference can be explained by any genome mutation at the present time. But if this is the case, I'm not surprised. The last question concerned the number 0 patient. I'm sorry, I'm not the right one to answer the question, because I think this is the task for the CDC staff. They should look for who is the index case for this whole outbreak. But currently, I have no idea what is going on there. Sorry for that. Thanks.
Okay, next question, please. Okay, the middle area, the lady in the fourth line with long hair.
Thank you. Hong Kong China Review News Agency. My question is about ECMO. We know that ECMO is recommended for rescue treatment for severe cases, how do you assess the role that ECMO had played so far? Are there enough ECMO equipments for severe patients in Wuhan? Thank you.
Well, thank you very much for that specific question. That is a specific question for ICU doctors like me, but not for my colleagues. I don't believe ECMO play an important role in the whole outbreak. For example, that according to the data a couple of days ago, there were 260 patients still on the ventilator. And there are 20-something cases. There are fewer than 30 cases treated with ECMO. And apart from this, we still have more than 4,000 patients hospitalized. I think that you can, have your own judgment based on this number, that ECMO, although a technical innovation to some of my colleagues working here and working in other provinces, is a life-sustaining treatment. But I don't believe, based on these numbers, it plays a significant role in decreasing the case fatality rates. Of course, it is a device to buy the time for the patient in order for the definitive therapy came to have some effect. So my personal impression is that no.
Okay, next question. Right area, third line, the gentleman.
Thank you very much. I'm from Japanese TV. It's called NTV. My question is, in China, various new technologies, including 5G network or robots, are using fight against coronavirus. How those technologies help doctors? And what do you think about the most dramatic change by these technologies? Thank you.
Thank you. I will take this question. You raised the issue of new technology in this campaign. But please, first of all, please allow me to make clear that I don't think it's new technology that rely on to bring the situation under control. I think we bring the situation control because we are still following the classic theory of epidemiology, which is control the source of infection, cut down the spread route, and protect those susceptible population. But on the other hand, in terms of new technology, I'm glad to share with you that our experience is that by utilizing the Generation 5 network, we have established a virtual online consultation system. So we routinely have those online meetings with experts in PMC hospital back in Beijing. So we can discuss some difficult and complicated cases with them, almost face-to-face. So I think this enables us to provide high-quality care to all of our patients. And also in our daily practice, we routinely use mechanical ventilation, bedside ultrasonography, continuous renal replacement therapy. So I think these new technologies will give us more weapons or opportunities to fight the coronavirus and protect people. Thank you.
May I have a few words? That apart from what Dr. Wu said, that as far as I know, that the teleconference with doctors and experts back into their mother hospital, a few thousands of miles away, is a common practice within each national medical team here in Wuhan or in other cities in Hubei. So this is number one. And number two, the so-called virtual hospital or virtual medical care system is not only for us, for the doctors, but also for the patients. Whenever the patients are advised to stay at home, if patients with other diseases other than COVID-19, especially in epicenters like Wuhan or other cities in Hubei, that they are advised to stay at home. But however, whenever they think there is any need to seek for medical advice, medical care, they can get access to the doctors through the virtual hospital or medical care apps. And the third, as far as I know, some of the investigators are now, they are trying to do some research that with the use of the wearable devices, then for those patients who are asked to do the home isolation, home quarantine, that some kind of the artificial intelligence will tell whether or not what is the probability that they have the COVID-19 or the disease progression, and when is the right time to go to see the doctor, or you should be okay to continue to stay at home. Thanks.
Okay, the very last two questions, one for foreign journalist and one for Chinese reporter. Okay, the gentleman in the middle area, third line.
Thank you very much. From the Wall Street Journal, thank you, doctors, for sparing the time to do this. Dr. Du, you mentioned the importance of preventing and controlling the disease rather than treating it. I was wondering if you could go into a bit more detail about what you think were the most effective steps that were taken in Wuhan to prevent and control the spread of the epidemic, and at what point those came into effect. I was also wondering, you spoke a little about the fatality rate. I take the point that it's a little early to calculate that, but given the evidence that the fatality rate does seem to have been higher in Wuhan, I was wondering if you could go into some more detail about why you think that was, particularly amongst medical workers. You spoke a little in the last briefing about treatment with steroids and invasive ventilation. I was wondering if you could elaborate on that a little. And with hindsight, is there anything that could have been done to avoid that? Or was it simply inevitable? Is there anything that you could advise other countries facing similar problems now? Thank you.
Thank you very much for the questions. The first question concerned with the specific measures to control the epidemic. I'm not an expert for this, but anyway, test, and test. Whenever you have no chance to do the test, I mean the nucleic acid test for COVID-19, you never know who is the carrier, who is the patient, and you never know who should be quarantined and who are close contacts. I know there is some, different approaches that here in China and in other countries, like what you are doing in the States. I'm not the one who make the judgment about which is right and which is, wrong. But anyway, apart from testing, I just have no idea how you can identify the suspected cases and how to quarantine the close contacts. I mean, there's just a question to Dr. Cao about what is the turning point. In my opinion, that the major reason or decision to turning point is that when you have the opportunity to isolate all suspected patients and close contacts, this is the turning point of the outbreak here in Wuhan and in Hubei. And the second question about that what specific factors contribute to the higher case fatality rates in Wuhan. I would say that it's still a strong belief of mine that the delayed mechanical ventilation, delayed endotracheal intubation, and long-term corticosteroids make a difference. I mean, they are major risk factors for mortality rates. I have seen dozens of cases who tried inappropriately or failed an IV trial. An IV meaning non-invasive ventilation. They failed an IV trial, but they maintained on the non-invasive ventilator. The doctors did not intubate them. But eventually, even after endotracheal intubation, after initiation of mechanical ventilation, they will still die. So we actually make a huge difference, at a later stage, to encourage every physician to intubate their patients as soon as possible, as soon as they believed that their patients failed an IV trial. And there's one study, although not quite large one, from the Tongji Hospital, from my colleagues in Tongji Hospital. They found that a much aggressive approach for endotracheal intubation will significantly improve the patient outcome. I believe the paper has been submitted, but I have no idea whether it's accepted or not. Thanks.
Okay, the last question, please. Okay, right area, second line, the lady, please.
Thank you. Question from China Daily. It has been more than a month since medical workers from across China raced to Wuhan to help fight the virus, and we know that you are all part of that effort. So my question is, what have the medical assistant teams contributed in terms of treating COVID-19 patients in Hubei and Wuhan? And after weeks of intense work, what is on top of your mind right now? What would you like to share with us the most? Thank you.
May I suggest each of you say a few words to this question, please?
Thanks. I'm not quite sure if I'm the right one to conclude the first question, because I think the question is to the healthcare authorities rather than us. But anyway, I'll come directly to the second one, that although this is a chance for us, my colleagues and I, to share our experiences to the international community. But I would say that this is also, or I would say that the Chinese approach for control of the epidemics may not be the only one, may not be the only approach. We can see what had been happened in Singapore, what had been happened in Japan. I would say my colleagues and I would also learn from their own experience that whenever you have a quite different situation, in terms of the number of cases, in terms of the community support system, that you can do a quite different way. You can adopt a quite different approach that achieved a similar success in controlling the epidemics. So it's also an opportunity for us to learn from each other, just like we said for what is true for the TCM and Western medicine. So last sentence from my side is that the beauty of the world lies in its diversity, but not identity. Thanks.
Okay, Professor Yan, please.
I think it's my great pleasure to come to Wuhan as a doctor in the intensive care unit to save my patients. Yes, in the coronary care unit, I I have so many casualties. This kind of experience I will never forget in my life. And also, I'm very glad to be here to share my experience to saving patients with overseas friends and my colleagues. Thank you very much.
Okay, Cao Wei, please.
I want to share some personal feelings. When 17 years ago, when the SARS came, I was still a medical student in college. At that time, I was the one to be protected. And this time, I was able to come here with my teachers and seniors to fight together for my people and my country. I'm very proud of that. And I'm sure that's the common feeling of all the medical workers have been here in Wuhan. And despite we have sacrificed a lot personally and apart from families for such a long time, but it all deserves. And at last, I want to to express my deep thanks and show respect for all the nurses that have been working with us. Without them, they have been taking the same responsibilities with us. And not like me, many of the nurses coming to Wuhan actually are very young generations. Most of them were born in 1990s with only remote memories of SARS season. But when it came, they all stand out and come here. And without them, we wouldn't have achieved so much, especially for these critically ill patients. So thank you very much.
Okay, last, Dr. Wu, please.
Thanks for the question. Also, some personal feelings. So during the last 5 weeks, I was totally devoted to caring for patients in ICU. So the only thing I feel sorry for is that I couldn't take care of my own family as a father and as a husband. So 5 weeks ago, when I left Beijing for here, my 8-year-old daughter asked me, "Dad, why you go to Wuhan?" To be honest, it was a question that I couldn't quite answer at that time. But last week, I had a patient in ICU. She was a 57-year-old woman, and she was very sick. So our plan was to intubate her and put her to a mechanical ventilation. That seemed the only way to save her life. Before intubation, she whispered several words to me in Wuhan dialect. So it was difficult for me to understand what she was talking about. But finally, I figured out what she said was, "Doc, I don't want to die. The end of this month is my daughter's wedding day." So at that very moment, and deep in my heart, I saw that many of our patients are parents too. And they love their own kids, the same as I do. And it also reminds me of the novel by Marquez, Love in a Time of Cholera. What I learned from the novel is that human beings are mortal, but love is not. So why I came to Wuhan is not only about professionalism or responsibility. It is also about love. I love my daughter. I love my patients. And I love my country. I love humankind. As humankind, we are all in this together. And we will get through this together. Thanks.
Thank you. I'm quite touched by what all these experts just shared with us. I'd like to say that the COVID-19 outbreak is neither the first nor the last challenge confronting all the mankind. The pandemic knows no borders. The only right thing for the world to do is to make concerted efforts. While combating the disease at home, China will work hand in hand with other countries and contribute our strength and wisdom to securing a final victory. Today, the 4 experts from the PUMC hospital shared a lot of valuable experiences. When they came to Wuhan, they don't know how long this will take and how many difficulties and challenges will be faced. But from what they just said, we know how important to have them with us in combating the virus. I'm sure people in Wuhan, in Hubei, will remember all of them forever. And the Chinese people will be very proud of them, all the Chinese doctors and nurses. So lastly, I suggest we took a group photo together and give a sum up to all the Chinese doctors and nurses. Well done. Thank you very much. That's the end of the briefing. Thank you. Bye-bye.